Uh, I think the culprit lies on the inside. With both head and neck cancers and to some extent thoracic cancers, the primary cause is tobacco and its related toxins. So I think we are, by and large, one of the most populous countries consuming tobacco in the most variants possible. So head and neck cancers really are triggered by tobacco and betel nut, whether you call it the smoked form or you call it the chewed form, or with betel nut, without, within pan, smoked cigarettes, even for that matter, unfiltered cigarettes, as we call them, BDs over here. So it's a huge industry, and I think it will be a paradox to realize that some of the women who are deployed in actually manufacturing BDs in rural India, which is a really huge cottage industry for some of the interiors of the country, are serious victims of head and neck cancers and probably significant addicts. Another issue with head and neck cancers is because this tobacco habit starts pretty early at very a young age. Statistics show that a lot of students in their teens are pick up this habit. And I think somewhere we are to blame as a system for this, because we allow for its availability to be there to such an impressionable age of children. Uh, I mean, just this is more has been something that has been close to my heart because I'm quite anti-tobacco, as it's one of the known causes of cancer. I'm not saying that head and neck cancer does not occur in patients who do not consume tobacco. There is a 30% component of them who do have it otherwise, but a huge chunk, 60 to 70%, is related to tobacco. So I am one of the forebearers who would be a proponent of trying to regularize the sale of tobacco and its products. Unfortunately, it's commonplace for all of us as a family to function. Even as in my childhood days, I remember, I think all of us would have helped out in the house by going and running across to the corner store to buy bread and eggs, or maybe biscuits or something like that. And the funny part of it, that same store that sells that also sells the pan parags, the cigarettes, and the other forms of tobacco in pretty bright, flashy, colored packets. Would invite any child to be interested towards it. And then if he sees someone experimenting with it while he's standing there and transacting for his simple bread and biscuits, he might get tempted to try it out with the leftover change. And that's how the habit starts. So I think somewhere, if we could regularize the sale of tobacco the way alcohol is sold, only from licensed stores, it would be a double-edged sword. It will actually you won't be sending a child to a tobacco store to buy bread and eggs. So you would go there intentionally only if you were addicted, or if you were willing to get addicted consciously. And two is, it by default, the licensing will lead to a significant steep rise in the cost of tobacco. So I think that's something that I would be happy if somewhere someone could implement. And all of these cancers that we see are very morbid cancers. The reason I'm concerned about head and neck cancers is because the head and neck zone is a very functional zone. It's the input point of all our five senses, from taste to smell to chewing to speech. So when we have head and neck cancers, we invariably functionally compromise a patient, whether it's the disease or sometimes even it's the treatment of the disease. So that's the reason why I would be very aggressive about anti-tobacco. Thoracic cancers are, again, a variety of cancers that are caused by some of our habits of eating. Spices are very high in our diet, so that could also be contributory towards some of our GI cancers. Lung cancers are again tobacco related and pollution related. A lot of it does get missed out in our country because of the high prevalence of tuberculosis. So that would be another bone of contention with thoracic cancers, where we could, kind of be a little bit more vigilant in picking them up early rather than in a very advanced stage.